I'm Abhi, one of the Hematology Oncology Fellows at Moffitt Cancer Center. We are here at ASH. Thank you so much for reviewing my poster. I'd like to bring to your attention our study, which looked at two different conditioning regimens in MRD-positive AML patients undergoing allogeneic stem cell transplant. We did a single-center retrospective analysis at Moffitt Cancer Center looking at MRD-positive AML patients who received their first transplant between 2015 to 2022. And we looked at two different conditioning regimens, which is the Flu-Mel-Ric reduced-intensity conditioning regimen with Melphalan dosing between 100 to 140 milligram per meter square, and the Fludarabine 150 to 160 milligram per meter square. The other conditioning regimen we looked at was the Flu-Bu-Mac conditioning regimen with fludarabine the same dose as the Flu-Mel regimen and Busulfan AUC 5300. So we looked at about 191 patients, of which 120 patients received Flu-Mel-Ric and 71 patients received Flu-Bu-Mac. And here are some of the patient characteristics. Our median age was about 61 years in both the regimens. And when you look at the HCT-CI 3+ comorbidity index, about 43.5% had 3+ CI, and when you look at the ELN 2022 adverse risk, about 63.9% of our patients had adverse risk ELN based on the 2022 risk category stratification. Our primary endpoint was overall survival, and our secondary endpoints were leukemia-free survival, non-relapse mortality, and relapse. So here are the curves, which is a Kaplan-Meier showing the overall survival in the Flu-Mel versus the Flu-Bu conditioning regimen. You can see that in the Flu-Bu it's 68%, whereas in the Flu-Mel it's 64%. And when you look at the other secondary endpoints like the leukemia-free survival, and this is the non-relapse mortality and the relapse between Flu-Bu and Flu-Mel, it's fairly similar. But when we did the multivariate analysis looking between the two conditioning regimens, it was not statistically significant. This helps us with gives us an option of using Flu-Mel-Ric as a conditioning regimen in older, less fit MRD-positive AML patients undergoing allogeneic stem cell transplant. Thank you.